Dr. Romero, thanks for joining me today.
Hi, thank you for having me.
Of course, when we scheduled this, I was super excited because this call is personal for me. I've had, my experience with gut health and some of the things we're going to talk about today, and as well with my athletes. But before we get into that, I wanted to get your background and specifically when it comes to what you do every day, naturopathic medicine.
Sure. Well, background, I really have to go back to being a high school athlete way back in the day. So I played volleyball and that was my passion, right? That's my sport. And I knew going into college that I wanted to focus on sports medicine and work with athletes. So I got my bachelor's degree in exercise and wellness. And so adopting healthy lifestyles and helping other people live healthy lifestyles is something that I always wanted to do. And then I graduated, started working. And when I decided that I wanted to go back to school, I looked into different fields. And a friend told me about naturopathic medicine. And I knew it like that's it. The philosophy on healthy lifestyles, but also being a physician to help people really just hit me with what I wanted to do. So, with that background of being an athlete and then also being a health coach and now being a physician, being able to blend the sports medicine side with the holistic side is what I love doing. And so, naturopathic medicine, for people who really aren't familiar with it, to put it simply, I like to say East meets the West, right? It's modern medicine, alternative medicine, kind of blended into an approach to treat patients. So, not only can we use conventional things like pharmaceuticals, but we have botanical medicine and other natural nutraceuticals, things like that we can do to help people.
So is it safe to say that the naturopathic approach, does it address more of the root cause of an issue as opposed to just the symptoms?
Yes, definitely. One thing that our profession prides itself on is how much time we really spend with a patient. You really get a lot of that one-on-one doctor-patient time. And the more time you spend with a patient, you really get to understand what their overall health goals are, but really dig deep into underlying causes. And that way we can actually investigate what's causing these issues, whether it is mood issues or digestive issues and so on. It's not something that we can just throw a drug at. We really want to dive deep to what's causing it and fix it.
Awesome. I think that's a nice transition. So I wanted to talk to you today about a few things, but one of them is gut health and it's important to athletes. Can you go into that a little bit for me?
Sure. I love that we're talking about this because I do feel people in the sports medicine field, athletes don't know about this. So, uh, athletes in general, in my experience, don't have the best nutrition habits, unfortunately, right? Sometimes they eat foods that are just convenient or fast and so on. But you combine maybe not having the best diet with athletes that are putting themselves at higher physical stress levels, and it is a perfect storm for creating gut and digestive issues. So we have high intensity exercise, which we know creates inflammation in the gut and actually creates some imbalance in the gut microbiome, which is the good and bad bacteria. And so now we have issues in the digestive tract on top of maybe poor nutrition eating habits. And then the athlete can have symptoms. So let's say fatigue, mood issues, skin issues like rashes, and then, of course, digestive upset. So those are the two things we have to think about with athletes and their gut health.
And to your point, I've experienced it where I've had athletes who have mentioned to me, they've had some issues with their gut, or maybe they don't know what it is, where everything upsets their stomach. Can you talk about what some of the food products that you see out there, maybe that may exacerbate those issues for them?
Sure. With the foods that tend to be problematic for a lot of people, whether you're an athlete or just the general population, really, are considered the high allergy foods in a way. So dairy, which can be really inflammatory, soy products. It's different than, let's say, an allergy like peanuts. People have anaphylactic reaction, but these aggravating foods, um, wheat, gluten. A lot of people are sensitive to that, and it can definitely cause problems with the gut.
Can you talk about a little bit the difference between like an anaphylactic allergy? Because I think a lot of people assume, like they think like, oh, you're going to get an EpiPen and someone's going to have to stab you in the heart or something. Can you talk about that, the difference between that and a sensitivity?
Yes, yes. I'm glad you actually asked that. So when we think of an anaphylactic reaction, like a bee sting or you eat peanuts, your airways close up and you have difficulty breathing, your face swells, your tongue and mouth swell. I, if I can mention this perfect example for a lot of people, in the movie Hitch, right? Will Smith eats some shellfish and then he has a reaction. That is that immediate anaphylactic reaction with those types of foods. So a food allergy, yeah, an EpiPen, you might need it to treat Benadryl and so on. But that is different than what we consider a food sensitivity issue, which is more of a delayed immune response. So food sensitivities, you might eat certain foods that can increase inflammation in the gut, cause some problems in the digestive tract, and then it manifests maybe a day later, 2 days, 3 days, even 5 days later, this delayed reaction. And then those reactions, depending on the person, can vary. So it could be headaches or it could be fatigue, their mood disorders, things like that. So it's not just the digestive system symptoms like nausea, vomiting, diarrhea, constipation, but there's other systemic problems. And so with those immune responses, they're considered what are IgG immune responses, a different immune protein that's involved, versus the anaphylactic reaction, which is considered an IgE protein. It's a different type of immune response. So food allergies, a lot of people get the skin prick test, right? You can test for all sorts of things, not just foods, but environmental, pollens, and dust. But then the food sensitivities is actually a blood test. So it's simple in that sense that you can get a blood test and actually look at that IgG immune response.
Yeah, I think this topic is so interesting to me too, not just because I personally experienced it, but it's so much that goes into it and how important the gut is and how much we don't know just as a general population. Specifically, I wanted to touch on something. So when I had my food sensitivity test and the allergens popped up, trying to find foods without those, you find that every food has the same. Every food has peanuts. Every food has brown rice syrup. Every health food has dairy. So can you talk about maybe the importance of eating varied foods and eating seasonally?
Absolutely. Eating seasonally and rotating your foods is one of the best ways to not only make sure you're getting a good variety of nutrients, but protecting your digestive tract and making sure it stays healthy. When we get in this routine of eating the same thing every single day, every single week, year after year, this overexposure to certain foods can be problematic for the digestive tract. And when somebody like yourself who's done food sensitivity testing and you see these results and you see a whole list of things you're not supposed to
22.
eat, right? The goal isn't to not eat these foods for the rest of your life, right? The goal is to temporarily suspend those foods, right? Maybe we have to remove the obstacle, right? And remove the aggravating foods, let the gut heal, give it some time to repair, maybe reduce inflammation, work on some other overall holistic things with your health. And then eventually we can reintroduce those foods again. And hopefully your body doesn't mount this immune response because not only are you healthier, but your gut's healthier. So that's a big misconception too, is people think that they can't eat these foods forever. I'm like, well, it's not forever. It's just temporary.
Along that line, what are some other like misconceptions? Some things people don't understand about gut health.
Ooh, that's a really good question. So I think one is that there is a balance between good and bad bacteria. And there's this idea that if you take a probiotic, you're good. But there are different strains of probiotics. There's ones that should be better for gut health. So just any old generic probiotic really isn't an answer for everybody. So sometimes you have to specifically find out which is good for that person. So the balance between good and bad bacteria is going to vary, and probiotics can absolutely be helpful, but you have to find the right ones for you.
And along those lines, with probiotics, can you talk about probiotic versus prebiotic? You don't have to get super specific necessarily, but what it would be the difference? Because I'm starting to see both, right? So what's the
Right.
difference between the two?
So I like to call the prebiotic like the food for the probiotic, right? It's what helps the probiotic. So you'll see them paired together frequently. But unfortunately, with a prebiotic and a probiotic, if somebody experiences bloating and gas from it, it's usually the prebiotic, not the probiotic. So sometimes I'll hear a patient say, "Oh, I tried this pre and probiotic over the counter and it created a lot of problems." Like, well, it could be not only that it's not the right strains of the probiotic, but the prebiotic that's in there.
Is there anything that, if you're buying, just a consumer buying something, is there anything that they should look for when it comes to a good probiotic?
Well, I would say that usually the higher quality probiotics are the ones you have to refrigerate. So a good rule of thumb, maybe if you're going to do a probiotic, typically they should be refrigerated to preserve it. If it's not, it may not be the best kind, but that's always a good way to follow.
So like the gummies that have probiotic, probably not a good idea. The ones that sit on the shelf for years.
It's not going to be the most potent, I would say. And especially if there are concerns like antibiotic use. If you recently had to use antibiotic and you want to make sure your gut is staying healthy, doing something like that's probably not going to cut it. You probably need a higher quality, more multi-strain probiotic to really replenish it. So that's going to vary too, is like, what's the reason you need a probiotic?
So in that scenario, when someone goes to antibiotic and they're, is essentially their gut health wiped, or their microbiome, is it like wiped clean? Like what happens in that scenario?
So often it kind of sways that balance between the good and bad bacteria, and not just in the digestive tract, but really it can be, there's bacteria all over us, right, on our
Yeah.
skin, and so with people who maybe have antibiotic use, who are more sensitive, let's say that causes them to have loose stool and diarrhea after antibiotics, right? That's the type of person who really needs to replenish it. Not everyone experiences that, but some antibiotics are more prone to causing that disruption than others. And some don't really do that. So it does come down to which one they take and if they are having that response. So what happens is it just lets that maybe bad bacteria get an edge up, right? And have a little bit more presence. And then it causes some havoc in the body.
Gotcha. No, that makes a lot of sense. I've heard a lot about fermented foods, whether that's, sauerkraut, raw sauerkraut, kimchi. Is there anything along those lines that would help gut health that you can typically find?
From my understanding, a lot of the fermented foods, although they are great, they can be great for the digestive tract, and eating them regularly do have a benefit. It doesn't have a high amount of live probiotics, as well as even, yeah, a lot of these dairy products that might say they have probiotics, and there's really not live probiotic strains in there. But what it does do, it does help balance that in the gut. So eating those foods, it's not like you're getting billions and billions of these probiotics. It's more about supporting that environment, and those foods do help it.
Oh, yeah, that's definitely good to know. I feel like they're marketed as such. So I think people think that they're getting, the raw organic sauerkraut and boom, my gut's fine.
Yeah.
So
Well, it does have a benefit for sure. It's not as has a lot of live probiotics, I think, the way people think they do.
right. No, that
Yeah.
makes a lot of sense. Um, I did want to talk about as well. So some of the common symptoms you mentioned, that you may find if someone has maybe some gut health issues. What would be some other ones that maybe aren't as expected or as common that people will have when they have gut health issues?
I would say the mood disorders for sure. Things like depression, anxiety, nervousness, and as an athlete in particular, if you're preparing for a competition, right, those nerves are going to play a role. Your ability to stay focused and calm under pressure. Uh, One thing that I want to mention is that connection between the brain and the gut, that brain gut axis, and our our gut, our digestive tract does produce neurotransmitters, and like serotonin and dopamine, right? So that part of the gut brain connection really plays a role. So if we have issues with gut health, so the inflammation and leaky gut, as people term it, it's considered increased intestinal permeability. It does play a role on brain function. So the mood changes, I think people aren't aware of when it comes to that.
Yeah, I think that's something that is hugely impactful, right? Mood, nerves. If you're an athlete, being able to perform under pressure, that's going to be critical. Even more so than just a regular, general population. So
Hmm.
the next area I wanted to talk about is micronutrients for athletes. I think a lot of people know what macros are, right? People count their macros all the time. Can you
Mhm.
speak a little bit about which micronutrients maybe, or let's say this: what's the importance of micronutrients, and how might that affect an athlete by not having the full spectrum or the right kind of micronutrients?
Yeah, for sure. Micronutrients are under discussed. Everyone focuses on the macros, like you said, the proteins, fats, and carbs. So the micronutrients, which are your vitamins, minerals, antioxidants, amino acids, that are really what are nutrient dense foods. And when I when I talk about micronutrients a lot, it really comes down to fueling your body and recovering your body. Right? If you don't have the micronutrients to fuel your body, you're not going to be able to produce energy or ATP for your cells. You're not going to be able to have anabolic effects like improving strength gains, improving muscle mass and lean body mass. And then on the other side of it, the recovery, you're not going to have the nutrients to repair. So things like zinc, vitamin C, right, to repair connective tissue, your tendons, ligaments, if you had an injury or a stressful workout, right? You need those nutrients to repair. So for me, it's how do you fuel your athlete from a micronutrient level and then also enhance their recovery from exercise or even injury.
I think that's especially true, right? In injury, you're more inflamed, and like you mentioned earlier in the when you were speaking about athletes are constantly inflamed. You know, they're constantly doing high impact activity. So when you think about, obviously it's different for every person, but what might be the most common micronutrients where people or athletes specifically are deficient?
I think the most common deficiencies with athletes are vitamin D, DHA, which is one of the healthy omega-3 fatty acids, zinc, their B vitamins, and glutamine for sure.
Out of those, which one would you like to talk about? Because I do want to have like a little bit of a personally interested in all that. So, which one of those do you want to go down the rabbit hole
Okay,
with?
we'll start with glutamine
Okay.
because I think a lot of athletes have supplemented with it, but they don't really know why. So glutamine is important for muscle function and not just skeletal muscle, but heart muscle too. But glutamine with increase when with intense strenuous exercise, prolonged exercise, glutamine levels do reduce in the muscle. So we're having athletes that are overtraining or doing a lot of intense exercise and they're depleting these glutamine levels. So glutamine does help with repair and recovery. So when you supplement with glutamine, you are providing that nourishment in a way to the muscles to repair and build and get bigger and stronger, right? And also it reduces soreness after exercise. So an athlete who is deficient in glutamine, they could be complaining a lot of sore muscles, not recovering the way they would expect after a workout. Even light workouts make their muscles sore. I think about glutamine. And tying it back to gut health. So glutamine is actually really important for the immune system and particularly the digestive tract. So with athletes that are deficient in glutamine, it actually reduces that food in a sense for your intestinal cells. Your intestinal cells, that immune function in your gut health rely on glutamine. So an athlete's deficient glutamine, it increases their gut inflammation, which then leads to digestive issues and gut health, leaky gut for athletes.
Yeah, that's very interesting. I think you see glutamine sold all the time. Would you, well, at least from my perspective, I often see amino acids with a lot of other stuff in them, right? Would you recommend just going as pure as possible, or anything additional to that, or like full BCAA, EAA spectrum?
Hmm. I think that for most people who are avid exercises or athletes, doing a little BCAAs occasionally, I think that's fine. But if we know there's a known deficiency with something, I usually like to isolate that particular nutrient and say, okay, we're going to supplement with this. If it's something we can't enhance in the diet, like let's say zinc, let's say an athlete's nutrient depleted with zinc, we can try to have them focus on the foods in their diet to increase zinc levels or B levels, whatever we need to. But something like glutamine, I usually will just have them take a straight glutamine product for a
That, ma-
while at least.
that makes a lot of sense. Focus on kind of what's deficient, what's missing.
Hmm.
Out of
Yeah,
those
and
that
then
you, sorry, go ahead.
the other thing I was going to mention um, with the micronutrients, and we can suspect an athlete it might be depleted if they're reporting soreness and muscle fatigue that's abnormal. But it's something you can test in the blood. You can actually test in their blood for glutamine and other micronutrient levels to find out if they're actually deficient or not.
That makes a lot of sense. Why, you probably want to know exactly, right, rather than just guessing. Um, what would be another one of those that you'd mentioned earlier that you'd want to get into? Which one of those micronutrients?
Oh, probably DHA.
Let's do it.
DHA. Yes. So the reason I mentioned DHA is because I feel like a lot of people are at least familiar with vitamin D and the B vitamins for energies and so on. But DHA being one of the omega-3 fatty acids, it is a very anti-inflammatory. So for an athlete who may be inflamed anyway, not just from digestive gut issues, but also from overtraining, taking DHA or having a diet rich in omega-3 fatty acids does help modulate that inflammation a bit. So a little bit of inflammation, of course, is good, but when we are too much inflammation, it can become problematic. And so DHEA does help with that. The other reason I mention it for athletes is because of its importance for concussion and TBIs, traumatic brain injuries, right? So for an athlete who has a diet rich in these omega-3s, healthy fats like DHA, it does have a protective effect for the brain. DHA is good for nerve cells and nerve impulses and keeping those nerves healthy in your brain. So those neural connections after concussion can be affected. And there is some research showing that an athlete that has a good diet with DHA, has plenty of those healthy fats, has a faster recovery after concussion. They're actually able to get back to play better because their brain is in a better state than an athlete who may have been depleted in the first place.
That's super interesting. Is there any evidence or anything in the literature about maybe like a therapeutic dose of DHA around the time of a concussion that would help?
So right now, when it comes to the healthy fats, the fish oil, for example, usually 1 gram, 1,000 milligrams is mentioned as a therapeutic dose. But I can tell you clinically, not just for concussion and TBI management, but lots of other conditions like heart health and so on, that you can go as high as 4 to 8 grams, depending on the patient. Now, I'm not saying everyone go out there and take that much because, of course, it can lead to thinning of the blood, and you can bruise more easily, things like that, which you don't want as an athlete. But you can actually do higher gram dosages for the recovery process when it comes to concussion and TBI patients.
As far as foods, you mentioned fish oil. Is there any other foods that are higher in DHA that athletes can seek out just on a regular basis?
Sure. And the cold water fishes, salmon, halibut, mackerel, right? Those are going to be usually the better sources. And of course, with fish, there's this concern with mercury and so on. So it was important to find out where your fish is sourced from. But mostly it's going to be the fishes. And you can get some healthy fats from algae sources, but mainly, salmon, wild salmon is going to be one of the best ones.
Do what am I thinking of? Like hemp seeds, chia seeds, are those options for anybody who's maybe vegan and doesn't consume animal product?
Sure, yeah. Flaxseed, hemp seeds, sunflower seeds, pumpkin seeds, they all have some healthy fats in there. Avocados, coconut oils, there's a lot of different healthy fats, and having a good balance and a variety, absolutely.
And along
Yeah.
those
And I was
same
going to ask,
lines, go
oh,
ahead.
I was actually going to ask you, working with athletes, if you've seen a lot of people supplement glutamine or fish oil, things like that regularly.
I do see glutamine is more popular. Fish oil, you're starting to see a little bit more. I think it's one of those things where there's an awareness about it. I think the biggest thing that I guess I hesitate on is that people don't always want to spend money for quality products, and sometimes they'll see a fish oil that's at sorry for anybody who works at Fry's or Walmart, but like something that's maybe not as high quality. And so
Hmm.
that's where I run, and maybe you can talk about this. I run into the issue of if you're not willing to spend the money on it, like a good quality supplement, is it even worth getting?
Well, uh, oftentimes it's not worth getting. Unfortunately, there are many over-the-counter supplements with vitamins that may not have the right form of the vitamin or the right therapeutic dose of the vitamin. So it is kind of a waste taking it. So yeah, there are some that I just don't find as a good option that are over the counter. I mean, there are some great physician grade products and high quality trusted products out there that you can get at certain over the counter stores. But again, the way at least I practice is you have to tailor it to the person. Taking a supplement is just another tool to help their body balance out. It's not something they may be on forever. And even if it is a expensive product, being on it for a month or 3 months, is manageable for most people. It's usually when they expect to be on a supplement forever, and if they're taking 20 supplements, it's going to get costly. And in my opinion, that's way too many. Right, trying to take a couple here or there for what your body needs, I think, is pretty reasonable. But with the cost, it can definitely get up there. But usually they feel the difference, right? If you, as an athlete, you feel the difference, then you're investing it in the right place.
Yeah, no, I think it's money well spent, and I mean I don't want to make this an infomercial for your services necessarily or for supplements in general, but I do really feel like the investment that you put into your body as an athlete, like what better tool than to utilize for that? And even though someone like myself, a little bit about what I did, this already, but I was having crazy hives and these reactions to all these foods. And I can tell you, getting a good quality supplement, and more importantly, I think, in I don't know if you agree with this, but it's probably my diet, right? Making sure I was rotating foods and making sure I was eating the right things was a night and day difference. So, it is a little bit of an upfront cost, but the way I look at it, it's like, well, you're going to pay one way or the other. You're going to pay on the back end by being miserable and being like, low energy. And I can speak from, sleeping better, things like that you don't intend, to paying in the front end and having a higher quality of life.
For
So
sure.
that's the way
And
I look at it.
and part of yeah, no, and that's how you should look at it, right? It's something you're focusing on now to get the benefits even long term. Because it's not just about getting, a test or getting the right supplement there, but it's really about what you're trying to achieve and that goal you want to reach eventually, right, in the future.
And one of the things we like to tell our athletes is you can't out supplement a bad diet. You can have, all everybody comes in, you see kids walk in with energy drinks, they're walking with pre-workout, and I'm thinking like, you're 16, what do you need pre-workout for? You have all the energy in the world. And they have all these things that someone at the gym, told them to get. And it is and one of the reasons why I wanted to have you on, because it is a source of, I would say, concern, frustration for me, because I do want to get the message out there that if you're going to put something in your body, first off, let's make sure we have the nutrition lined up. Like, you're take a 16-year-old, maybe football player. You're in the prime of your life as far as you're going through puberty. You have natural testosterone coming through your body. Like, you don't need to rush it. So that's one of the things that I get frustrated with and concerned with, is everybody wants to, have everything quickly, and they will also want to do it at a cheaper cost. And to me, it's just, let's figure out what you're eating, and let's figure out, what we can do to maximize that, optimize that, and then supplements would come in later. So that's why I think it's so important for people to have resources such as yourself that are going to take the time to, talk to them and sit down and really figure out what their needs are.
Yeah, no, thank you. And I love that saying, they can't, out supplement a bad diet. It's so true. So I love hearing that. uh, with with athletes, sometimes they do need the hard evidence, right? They need to see the blood work. They need to see the labs to actually show, okay, maybe my body is depleted. I didn't know it. If a lot of times too, if they are training, they can't get to that next level, right? If you're training somebody and they're trying to hit certain RM, or or they're trying to increase their speed, but they're not able to get over a hump, it usually comes back on the lifestyle, right? Is it their nutrition? Is it their sleep habits, which are, in my opinion, the two most common? The athletes aren't sleeping, they're not eating right, especially high school athletes. They're training, they're trying to get school and straight A's, and sometimes they have jobs, right? It's hard for them to get the sleep and the nutrition they need.
Yeah, no, I think one of the things too is they don't realize the impact that it can make, and when they do, it's night and day. I have an athlete that I work with who has had issues sleeping, and he's sleeping much better now. And he mentioned to me just, I think, 2 days ago, or maybe it was a little bit longer than that, but he said, I didn't have good sleep the other day, and I really noticed a difference. And that was his norm. His normal was sleeping 4 to 6 hours a day, and now getting 7 to 8, even 9 sometimes. It's like a complete night and day difference.
Well, that's
One,
when we repair, right? That's
yeah,
when our growth hormone releases, and that's when our body needs to kind of work on all the things we did that day to get better the day after. And yeah, if they're not sleeping, they're not healing. I say that a lot with my with my patients and athletes. If you're not sleeping, you're not healing.
Yeah, and along those same lines, could you touch a little bit more on the benefit? Say, if you're an athlete, listen to this, or you're a coach, listen to this, or a parent, and you want your son or daughter, maybe in the case, to add lean muscle. Can you talk about like how important sleep is for that process of regeneration?
Yes, definitely. So when we sleep at night, our body goes through natural release of growth hormone. So we have these pulses of growth hormone, and growth hormone, it triggers the release of something in our body called IGF-1. IGF-1 actually signals to your bones, your muscles, your fat tissue, and it helps with lean body mass. It helps with reducing body fat, helps with muscle repair, those muscle cells, and improving cellular function and rejuvenation of our cells. So when we sleep, we have this natural repair process, this like anabolic process in a way. And without that process, without getting that deep sleep, what happens at night, we're going to lose out on all those benefits. So if you just trained really, really hard, but you're not sleeping, you're kind of throwing a lot of that out the window, right? It's you spend all this time training, but then where you really get your benefit is when your body can actually repair and rebuild, and that's going to happen at night. With People hear about growth hormone being abused, right? And it is something that can be abused, unfortunately, which is what we call super physiologic levels. Like you abuse something to get above what your body's naturally going to do. That's not good. That's not the type of growth hormone support you want. You want to support your body's natural rhythm to repair and rebuild, and that's going to be when you sleep.
Yeah, we're not talking about the Barry Bonds, head getting bigger at 35,
Mm-hmm.
but that's
Yeah.
usually that's one of the lead-ins to talk about sleep, especially with boys who are trying to gain weight, or with anybody. But I talk about, hey man, you're just essentially wasting your workout by not allowing your body to repair. So that's a good lead-in to talk about sleep, because otherwise it's it's just kind of not always received well.
Mm-hmm.
One of the things I did want to get into as well, and this is maybe more of a general question, but how do you feel like your approach to athletes is different than maybe what you would normally see? Like, do you look at it from a different lens than, say, another healthcare provider that might be just looking at it from purely a small lens, if that makes sense, like a bigger
Yeah, it
holistic
does.
way?
Yeah, it does make sense. Well, one perspective for me is that being an athlete, right? For competing at a higher level, I know what it's like, and I know that desperation to want to get better and do well. So I have that, and I can relate to the patient. I can relate to the athlete and what they're trying to achieve. So for me, that's one thing that I think sets me apart from maybe some other physicians who work with athletes but don't really, or have never really been there personally. And the other thing too with maybe sets me apart is a lot of times with physicians, I'll see them do the blood work, or they'll do the food sensitivity testing, and they give the results to the patient, but then they don't actually develop a treatment plan to do anything about it. And I think one thing that I try to do is just spend a lot of time going over the treatment plan and really working towards that patient's goals, that athlete's goals, and understanding the requirements they need. Because I've had athletes that I've worked with whose physician have told them, "Oh, you just need to rest and not train." Well, that's not an option for athletes, college level athletes, professional athletes. They have to continue to move. They have to still, their body is really what's going to take it to the next level. So an athlete to hear, "Oh, I'm supposed to just rest and be sedentary to let my body heal,"
It's not
that's not
possible.
a good approach. No, it's not. It's not realistic for them.
We get that all the time with soft tissue injuries, and sometimes you do need to immobilize and all that, but it just creates also this fear of training. And there are ways, certainly, like if you sprain an ankle, I mean, you need to move that. you know you can't just sit back, elevate it, and then pretend it's going to be better in 2 weeks. That's something that definitely is something we hear quite a bit too.
Hmm. And there's a way to utilize restorative exercise, restorative movement. I've had athletes where their cortisol, their stress hormones are just depleted, and they're so fatigued, right? But there's still ways to restore them without overtraining, rather than just say don't work out at all.
Yeah, there's a spectrum, right there. It's not go to nothing, and it's not
Hmm.
go 100% all the time, right? There's different ways that you definitely can do it. as we start to, there's been a lot of great information that you've given, so I appreciate you there. As we start to kind of wrap things up, I wanted to ask you a question. What would you, and this is kind of a broad question, what would you change if you could change one thing about how we approach healthcare for athletes or just in general? What would be one thing that you would want to change?
Wow, what a question. What had changed for athletes? Um, so I think a big area to focus on with athletes that maybe missing the point is the hormone aspect, because there's a range when it comes to hormone levels. And as a physician, you look at that range, you look at where an athlete is, and just because they're normal doesn't mean it's optimal for them. And when this could be hormones like the sex hormones, like testosterone, or even the thyroid hormones, there's a lot of different hormones in the body. But I find that just within norm doesn't mean it's okay, right? Everyone's different, and finding an optimal level of hormones and endocrine balance for an athlete is going to be really key. So for treating healthcare or athletes and with their healthcare, looking at their hormone function, I think is undervalued for a lot of physicians. So for me, I think really determining the hormone profile, because it's often seen if you're under 30, there's no point in running hormones. There's no point in checking your hormones. Well, that's not true. You can have hormone balances at all ages. And if you're an athlete, you really rely on those hormones to, you know, perform and recover and feel your best, mood, even things like that. So I think that the endocrine piece with athletes is where we could improve on.
I just opened up a can of worms, right? That was that we'll have to say. There's so much there that we'll have to save that for maybe a round two, because there's a
Mhm.
lot of, I think, information there that we could definitely get into. Um, are there any final thoughts that you'd want to say to anybody listening?
Sure. I kind of touching back to the gut health when it comes to athletes training at higher intensity exercise levels, is that with higher training levels, higher strenuous exercise, it does create an inflammatory response in the body. We know that there's a level of exercise that produces good responses. We have almost like a protective stress effect when we exercise at moderate levels. But when we get to strenuous, it is going to create more inflammatory processes in the body, leading to more injury and disease and so on for athletes. So I think for me, a big takeaway is for an athlete, listening to your body as far as, symptoms, fatigue, mood, digestive issues. It's not just that you're overtrained, it's that you're overtrained and your body needs resources, whether it is the sleep, the nutrition, and other types of movement resources. But for me, it's that high intense overtraining leading to higher inflammation levels. You can do something about it. It's not just that you have to be inflamed all the time. You actually can be proactive with helping your body get better.
Perfect. I think it's a great way to wrap things up. Where can people find you if they want to learn more or if they want to get in contact with you?
Sure. So Instagram is actually a great way to get in touch with me. My handle is at Dr. Kelly Romero. But from there, getting to my website, drkellyromero.com, the two best ways to get in touch with me and follow up with any questions or concerns.
I would also add that you put out some great blog posts and free content, so on your website and through Instagram. So anybody who wants to learn more about this, I think there's plenty of resources there for you as well. So
Thank
um,
you.
of course, yeah. Well, I appreciate your time. Thank you so much. I personally learned a lot, and I'm hoping the audience appreciates it as much as I did, because this was like, if you see my notes, too many notes. So I appreciate your time. Thank you.
Oh, you're welcome. Thank you for having me. I had a lot of fun.